Good morning and welcome to you all. It is so great to see you all live and in person, back together, better than ever. On behalf of the NCCHC Board of Representatives, the Governance Board, our CEO, Ms. Deborah Ross, and all of us from NCCHC, we are so happy that you've joined us in beautiful Chicago, Illinois. It's been way too long and we are so happy to have you here today, and even more lucky to have with us two dedicated professionals to serve as our keynote address. Essential matters have kept them away from being with us in person, but it's my pleasure to bring them to you in a way that we have become all too familiar with these last 18 months, virtually. So joining us for a conversation about COVID-19, racial disparities, and corrections are our esteemed and respected panelists, Dr. Marcella Nunez Smith and Ms. Liesl Hagan. Dr. Marcella Nunez Smith is Associate Dean for Health Equity Research, CNH Long Professor of Medicine, Public Health and Management, and Director of Equity Research and Innovation Center at Yale University. Her research focuses on health and healthcare equity for marginalized populations with an emphasis on the social and structural determinants of health, the influence of healthcare systems on health disparities, and the advancement of community academic partnered scholarship. Dr. Nunez Smith currently serves as Senior Advisor to the White House COVID-19 Response Team and Chair of the Presidential COVID-19 Health Equity Task Force. Previously, she served as co-chair of the Biden-Harris Transition COVID-19 Advisory Board and chair of Governor Ned Lamton's Reopen Connecticut Advisory Group Community Committee. Originally from the U.S. Virgin Islands, she attended Jefferson Medical College, residency at Harvard's Brigham and Women's Hospital, and fellowship at the Yale Robert Wood Johnson Foundation Clinical Scholars Program. Ms. Liesl Hagan is an epidemiologist with the Center for Disease Control and Prevention, where she leads the COVID-19 Corrections Unit. In addition, she serves as Senior Scientist for Correctional Health within the Office of the CDC Deputy Director for Infectious Diseases. Her team develops guidance targeted to correctional and detention facilities and works with prisons and jails, health departments, federal agencies, and other stakeholders on COVID-19 surveillance, data analysis, and outbreak investigations. Prior to COVID, she focused her work on the prevention and control of viral hepatitis in correctional settings, and she co-chairs a working group on correctional health with CDC's National Center for HIV and AIDS, viral hepatitis, STDs, and TB prevention. Dr. Nunez Smith, Ms. Hagan, thank you both for being here with us this morning. Let's get started. Dr. Nunez Smith, I think a great segue to get our discussion started this morning is from your own personal family experience as a child. You've described your father as a champion and a fighter as he dealt with how the system failed him in terms of healthcare. How did this shape who you are today and your vision for the future?
Thank you. It is wonderful to be here with you and with everyone, and of course, with Liesl on this panel, on this conversation. So looking forward to our time together in discussion. I'm grateful, appreciate you asking about, my father and our family and how his experience and my childhood experience really motivates and pushes me. I mean, my father was in his early 40s when he suffered his first stroke, which was a massive one, and left him paralyzed on his left side. He was a general contractor, really active person, really community focused. And this, of course, was just a devastating turn of events. My father did not have a bitter day right up until, we lost him in 2008. He was never angry and he held to his faith. And he was never mad at a system that, quite frankly, I thought failed and failed him and failed us. I mean, just preventable conditions, not diagnosed, not well managed. When we think and all we know now, the holistic drivers of health, healthcare being one and so important, but everything else, right? All of those other social economic factors that, can really conspire either for or against achieving one's optimal health and well-being. So I prioritize joy and gratitude as my father did, and I always try to bring that spirit of hope and optimism to the work. But we definitely have work to do, and my own personal experience as a child, and certainly now as a physician, really, really remind me every day just how many lives, right? This isn't about numbers. This is about people and families and communities. It's got to motivate us to do better.
Wow, what a great story, and drawing inspiration from a great man. So, and now as you serve on President Biden's COVID-19 advisory board, what are some of the biggest challenges or barriers that you're facing or your team is facing?
Yeah, this is such an honor, right? Such a privilege to be serving in this administration. I am lucky to wear a couple different hats, and as you mentioned, so one is as senior advisor to the White House COVID-19 response team, which I often describe as sort of our now work, our day work. I mean, every day, that team is charged with making sure that our COVID-19 response is fair, right? It's equitable, it's efficient. And the work there spans. I mean, it's everything. How do people get the resources they need, whether that's PPE or testing or treatments and therapies? Gratefully, that toolkit is expanding as well. And then, of course, vaccines and vaccination, trying to vaccinate an entire country. The spirit there in that group, it is we work. That's always going to be the approach, but equity, everybody here knows that this is about partnerships, this is about collaborations, this is hyper local, right? This is about people who are trusted leading the way, bringing tailored messages, accurate information to the people they know, work with, care about, communities they themselves identify with, and that's great. And then separately, I have the deep honor of chairing the Presidential COVID-19 Health Equity Task Force, tremendous group of people who have come together to, in an advisory capacity, right? Thinking about now, but yes, thinking about tomorrow as well. How do we recover? How do we rebuild in a way that's resilient, that we disrupt this predictability of who gets harmed first and harmed worst every single time? Because we know it's not a matter of if, but when. And so that group's work is wrapping up. Over 300 recommendations generated, and we're getting ready to submit that report to the president soon. And just inspiring spaces, both, really.
Wow, that's amazing. And your experience in the public health sphere and our experience in the correctional healthcare sphere, we always remind our colleagues that work in correctional healthcare that correctional healthcare is public healthcare,
Yes.
When we send them back into the communities that they live and their families live. So what can our correctional healthcare partners learn from your experiences addressing barriers and access for vaccinations in the public healthcare arena? And those might be some of those many recommendations that you're getting ready to put to the president.
No, thank you. And I mean, I think these are some of the recommendations, yes, and the principles, yes, that the White House COVID-19 response team really leans into. The president gave us all a charge, thinking about the CDC, the entire government, right, really charged to focus on equity. And I love what you said, because it's so true, right? Correctional health is public health, absolutely. And let me just take that moment to say thank you, right? Thank you for everyone who's joining us today, for all you're doing. My goodness, right? And I think, listen, these are some of the principles that I would share, and I hope will resonate, because people know this from just their own daily walk, right? But first and foremost is, of course, the access question. I think whenever we talk about equity and making sure we're connecting with everyone, that ensuring just access, right? That's about ease and convenience. And certainly when we talk about COVID-19 vaccines, the federal government has made sure that those are free. There shouldn't be any, out-of-pocket cost to anyone, and just those resources are out there. So promoting that access, necessary, right, but insufficient. That next step is really, I think, the harder work, whether it be addressing additional sort of structural barriers that someone might face, but really it's a communication question. How do we go about the work of building confidence, really just being respectful in that work, honoring, right, that it will take different amount of time for people to be vaccine ready, and just never being dismissive, understanding how valuable every one of us is, right, and worth the 5, 6, 7, 8, some people, I'm on 20 conversations, right, that it's going to take to make sure that their questions are getting answered. And I think that's just part of our work every time, is continuing to be present, to be engaged, and honor people on this journey, right? That's part of the public health mission, is saying, we're gonna make sure that access is there, but we're gonna meet you where you are, right? At every step of the way. And I hope that these are principles and ideas that resonate with everybody. We are so fortunate, I always say, and blessed to have the toolkit, right? We know what to do to get ourselves to the other side of this pandemic. But if ever there's a reminder of our collective kind of investment, right? Like it's a pandemic. It really is about each one of us doing everything we can to protect ourselves, yes, but beyond that, our families and our communities, right? It's an imperative.
Absolutely, absolutely. So, Ms. Hagan, keeping in mind what Dr. Nunez Smith just shared about kind of the disproportionate impact that COVID-19 has had on communities, in the United States, and people of color, and you and I have talked about this before. We in corrections, we must add that additional layer to the conversation about health equity, right? Knowing the unique challenges in corrections. What are your thoughts?
Sure, and thank you again for the invitation. And I just want to reiterate what an honor it is to be here with you, Dr. Nunez Smith and Jim. And this conversation is so important. It's one that we've been having at CDC and that other institutions have been having in a variety of different ways. And Jim, as you said, correctional health is public health. And one of the things that we have been trying to do at CDC in the corrections unit is to bring that into a very concrete messaging for the folks who work in corrections, because you guys are on the front lines every day doing public health and doing health equity work. And everything you do in corrections to promote health is promoting health equity, like you said, because of the intersection of race and incarceration, knowing that incarceration disproportionately affects communities of color, just as COVID-19 is disproportionately affecting communities of color. And then layering onto that, the particular difficulties inherent in correctional facilities, as you have them listed here. First of all, as I'm preaching to the choir here, everybody knows that these are true, but just for some validation, I suppose, just the dense housing arrangements that are a fact of life within a lot of correctional facilities can result in very rapid and widespread transmission that's extremely difficult to control. Then we have the disincentives to report COVID-19 symptoms. Folks don't want to be quarantined. They don't want to be isolated. It creates a disruption in daily life in a situation that's already very challenging for them. And so a lot of times people who are incarcerated don't want to report their symptoms of COVID because they don't want to be moved away from their typical housing units. And then you have the high prevalence of underlying diseases that has existed within correctional systems and within populations who are incarcerated. And we know that a lot of those illnesses also increase people's risk for having severe outcomes from COVID. So then you get into mental health, where you've got folks who are quarantined as a cohort after they've been exposed to COVID, and they end up in quarantine together. There are new exposures, quarantine starts over for another 14 days, and that just goes on and on and on. And people aren't able to access the visitation and programs and in-person resources that they're accustomed to. And as we've seen, I don't think any of us expected to be here 18 months later doing the same things. And the mitigation measures that we've put in place are starting to have dangers to people's mental health. And so that's really difficult in corrections, given that people inside do not have the agency to make those decisions for themselves. And then finally, from a public health and systems perspective, we really don't have coordinated data systems to monitor what's happening at a very granular level. We know what trends are occurring based on what partners are telling us, but we're not seeing the same kinds of systematic data collection in corrections that exist for other parts of society. And so that's an area that we need to improve in order to address health equity within the correctional population and to address racial equity within the correctional population.
Dr. Nunez Smith, Liesl brought up a great point about the health equity research. You've been at the forefront of this, of health equity research. And my question would be, how will this experience that you've had drive us to the unknown of what comes next?
Well, I'm very hopeful and optimistic, right, about us being able to meet this moment and having what comes next be really aligned with that North Star that we've set for ourselves in this space around the course correction that's needed, right, to disrupt these patterns of predictability in terms of those harmed worse. and harmed first. I just, I was nodding so vigorously, Liesl, I don't know if you could see because my head, I almost lost it. I just was, so grateful, right, for laying that out and really, even underscoring all of it. But that last bullet, we just need a data ecosystem that can help us. I do not subscribe to the bad person hypothesis, right? I really think that we need to have systems and structures that enable us to work, right, and serve for equity. I mean, no one's getting up in the morning and saying, today I want to help perpetrate inequities, right, in health. That is not how it goes at all. But we have created these systems that are just clunky and don't help at all. And often we create disincentives. And so kind of getting things aligned, having these standardized data, being able to support, like provide the technical assistance and everything else so that we can, in fact, do that good quality data collection and data reporting, and help providing those resources so then we can be able to really ground our decision-making in equity. So, I know it's not always the most glamorous thing to talk about, but I just think it always begins with data. And then, having that, I think those quantitative data, and then just the power of the narrative too. And I've been fortunate to just be in conversation with so many advocates kind of from the whole correctional health world, right, in this process. I've learned so much. I've been grateful for those group conversations, those one-on-one conversations, and those narratives really inform the work as well.
You're leading right into where I want the discussion to go, because everywhere, and I'm going to come back to you, Dr. Nunez Smith, about community data. Liesl, you and I have talked about data ad nauseum, many, many times. So everywhere I turn, it seems that every conversation I have that involves correctional healthcare, the lack of data always seems to be part of the conversation. Is it just me? Could we do a lot better? How do we get there and get better data?
I think that is the million-dollar question for all of us. There's so much that we can do, but I did want to touch on what Dr. Nunez Smith was saying about individual narratives too, because data are important, but I think especially at the population level, it's very easy for those of us in government research to not think about that individual level story as often as we should. And one of the things that I really appreciate about the pandemic partnerships that have developed during this time is the ability to get out into the field and to talk with people, talk with staff, talk with people who are incarcerated about where they're coming from, what their stories have been, and how this has impacted them. And always keeping that individual narrative together. And really, the public relies on us to put out evidence-based guidance. And in order to do that, we have to have two things. We do have to have the data, but we also have to have those partnerships, because we can't get the data without working through the folks who are in the field. And so, we've been out on countless deployments to investigate outbreaks, and on the phone with you, Jim, and other folks in the field to hear what's working and what's not working. And then that helps to drive our guidance. There's formal data when it comes to, special epidemiologic studies in the field, but then there's also informal data. And that's really where all the people coming to the NCCHC conference have come in for us. And I just want to thank everybody here today, and those who aren't here, for investing the time and the effort to help us understand what's happening in your facilities so that we can then serve you and serve the populations that we work with together to put out that evidence-based guidance.
So Dr. Nunez Smith, do you think that data in the community will improve through our experiences here? I don't know how it's going to improve in corrections, although we're trying every day. What about the community just collecting this kind of information?
Yeah, no, I love that vision. And only to piggyback again, right, just this partnership idea that Liesl raises. I think that is part of the strategy for how we do get to improved and enhanced data everywhere, but certainly community data. I love all the community scientists who are out there. I have a public-facing email account at Yale, and I get a lot of really interesting emails from people, but so many of them are folks who are essentially community scientists, right? Who are reporting on what they've seen, what they've observed. I was teaching a class the other day to our Yale undergrads, and I said, data is anything you can use to act on. And so kind of reimagining, because I'm like, data without a way to be actionable is just noise. And so, being able to understand the richness of the sources is tremendous. Just, I know in my own career, this way that we approach the work in a partnered scholarship framework, right? Where it's always about saying, well, who is here at this table with us as we are asking and designing, right? Even these instruments that Liesl refers to, like these surveys and other things, who is deciding what the metrics are that we need to follow and measure, what our benchmarks are, what we should be holding ourselves accountable on, who gets to be part of that process and that formation, and being sure that we're inviting everyone there who is affected, right? We always talk about the stakeholders and the stakeholder network and web. I think that's just critical. So this how are we going to do the work of data? I feel very hopeful about having new strategies there. And then of course the what are we going to collect? What are we going to monitor? What are we going to follow? But I do think ultimately the data that we need, it's going to be from across sectors. We have lots of pathways now with new technologies and other things to also collect data in a way that isn't a burden on everyone. Because I know everybody that that is in earshot is already at max, right, with the things that we're asked to do, and right. So thinking too creatively about ways that we could collect data without adding burden on everyone who already is doing 4 and 5 jobs. So I think that how piece is really important, and that what piece. But I have every confidence that we can get there and that it's so necessary. There is nothing else to do. It's just resource squander until we're figuring out how to do this in a data-driven way.
And I would add to that too, that we have to demonstrate the value of the data for the facilities that are reporting to us.
Yes.
But if we don't turn that data around to be valuable for their daily operations, then they're unlikely to report it. So I think that is true for any data we collect, but for data on race and ethnicity as well. I think there's a lot of uncertainty as far as how data on race and ethnicity would be used and how it can be used to improve the situation and how it can be used to drive change. And a lot of people, I think, are uncertain about, well, are these fields actually required? Are they mandatory for case reports? Or is it just a nice to have? And what kind of impact is it going to have anyway? So communicating and educating folks on the ground about the impact that data can actually have.
100%. Thank you.
Well, it was great information. Thank you so much. Data is going to continue to be very important in all of our fields. But Ms. Hagan, there's a fine balance that those working in corrections and correctional healthcare have to manage, specifically in dealing with COVID-19. Given your experience over almost 2 years now, how do we find it, that balance in prevention?
That is a really important topic, and one that we are constantly grappling with our partners. And, I don't think that, again, I don't think anybody thought that we would still be in this place putting forward very intensive mitigation measures 18 months in. On this slide, what this demonstrates is you've got the left side of the equation. You've got the risk of transmission, severe illness, death, post-COVID conditions. That's really where we've been focusing our energies for the first part of the pandemic, trying to keep people from getting infected as best we can, knowing that the outcomes can be so severe. But as we've been moving on with this pandemic, we have seen the unintended consequences of all of those mitigation measures that they have had on mental health, on quality of life, needs of the operations of the institution's mission. And it is about trying to figure out what is the right balance. And, as Dr. Nunez Smith had said, one of the best tools we have in our toolkit is vaccination. And that is really going to help us achieve this balance. If we can get the majority of folks vaccinated within these facilities, then some of these intensive mitigation measures can be relaxed so that we can focus again on mental health and quality of life. So it is a constant struggle, and it's different in every institution. I know that everyone subscribes to the adage that you've seen one correctional facility, and that's true. And in public health, we know that even more now than we did before. So this is something that we have to work on together, and we have to, just really appreciate the partnerships that we have to learn more.
Well, and I want to leave this slide up for a second because, thinking about it and listening to you from my lens, coming from, corrections and running a jail, I can almost substitute COVID-19 prevention and corrections with any other thing that our correction world is dealing with, of suicide prevention, health and wellness of the staff, infectious disease, bed bugs, lice, And I could see where the mental health, quality of life, and operational needs on the right substitute those for all the other things, the unknowns that we're dealing with. And Dr. Nunez Smith, I can only assume that your work with the White House and in the racial disparities and public health, you can do the same thing. Am I right?
That's right. I just was agreeing with you so vigorously, Jim. I do really appreciate this slide as well. And just a reminder, right, of just all the walk and chewing gum, as we say, that we have to do always, right, in this space. But hopefully, I think that if we are really thoughtful and intentional, then when we invest, in this sort of the bottom half of this slide, that we're going to see the benefit across multiple domains and dimensions and conditions. And so it is both this reality of like, oh my goodness, there's a lot that everybody is trying to contend with, a lot that we're trying to move down the field. But thankfully, the denominator there, I think there are a lot of shared realities in terms of root cause and opportunity for intervention.
I totally agree with that. That's such a great way to wind that risk balance up. So I'd like to ask one final question to both of you. Both of you and almost all, if not all in the audience this morning, work in extremely unique circumstances. We see the best of people and the worst of people. So my question is this, and it's borrowed from an article I read while preparing for this panel, full disclosure. How do you find joy in the challenges of your work? How do you maintain that optimism, especially in the unique and unprecedented times that we've been experiencing and are continuing to experience? And Dr. Nunez Smith, I'll turn to you first.
Oh, we have to find joy, right? I mean, I was just texting with someone right before we got started and they said, how are you doing? And I said, oh, looking and prioritizing gratitude moments, right? I mean, we absolutely have to do this. We have all been called upon, right, in this moment to bring our talents, to bring our contributions, everything. The audience with us today, you are difference making every day, right? I know it can be hard, whatever time that alarm clock goes off, right? But you are difference making, and to know that. And looking ahead, for me, I'm fortunate to be a parent. I have 3 young children, and what brings me joy and gratitude and motivation is saying, we got to do better for them. What is this legacy going to be? What are we handing over? And so in those moments of just fatigue and exhaustion, and that's okay, to remember that. And let's just show ourselves and each other grace, right? And do that. And I think like these small acts of kindness and consideration are going to carry us really far. So, I'm so grateful, right? Gratitude moment to be here in this conversation, in this space with all of you, to have this chance to say, I appreciate you and I appreciate everything you're doing for our communities and for our country. So just thank you.
It's funny you should say that when people say, how are you doing? And the response that you give when someone asks me how I'm doing, I will typically respond better than I deserve. And after they stop laughing, I'll say, I know what I deserve. And I certainly don't deserve the friendships that I have in this room with us today watching this panel. So, it's funny how the world puts us in places and, gives us just enough that we can handle. So I can embrace that and appreciate that. Liesl, same question. How do you find the joy in what you do and, the challenges of your work and find your optimism?
I think it's a variation on the theme that you both brought up already. One, and to keep beating on that partnership drum, it's really all the people that I work with and seeing everybody find creative solutions to problems where maybe they would have been reticent to work with a certain other group before in their facility. And now they're coming together because, like Dr. Nunez Smith said, we're called upon to make this happen in this moment. And then more personally, on the parental front as well, and on the gratitude front, every night at dinner, we go around the table and say what we're grateful for. And right before I left for a 2-week deployment to a facility that was having an outbreak, my 5-year-old said, Mommy, I'm grateful that I have a mommy who helps people. And I was like, wow, I am going to cry. And that is the sweetest thing I've ever heard. And I really carried that with me. And I thought that's a charge to me that I am in this field because I want to help people. And we're all here because we want to help people. And we want to model that for our children as well. And, this is creating opportunities for us to teach our kids about equity. And, my daughter in particular has become very has a lot of questions about the Black Lives Matter signs in the yards in our neighborhood, and it's been asking a lot of those questions. And all the situations we run into every day provide those teaching moments. And so I'm grateful that we can take advantage of those opportunities to teach and to learn and be grateful for one another.
Well, that is just unbelievably wonderful. And we have a room full of people who are doing exactly that as well. And thank God they were put there in the place of the time that we're experiencing. So, our audience this morning are the hardworking women and men representing all areas of medical directors, directors of nursing, they're department managers, supervisors, health service administrators. They're the boots on the ground personnel serving in unique and challenging environments. So I would ask you, our audience, to consider the question that I just asked our panelists. When our own personal health and mental health awareness is more important than ever before, please consider where you find your joy and optimism in your work and those that work around you. May just be a good conversation starter as you enjoy the rest of the conference. So anyway, wow, what a great way to kick off our national conference on correctional healthcare. I want to take a moment to thank our panelists, Dr. Marcella Nunez Smith and Ms. Liesl Hagan, on behalf of all of us in the NCCHC Board of Representatives, our NCCHC leadership, and on behalf of all those who are in attendance this morning, thank you, thank you, thank you. I can't tell you what a privilege it has been for me to just share a little of your time this morning. Dr. Nunez Smith, we wish you all the best, and we support you as you continue your efforts of making sure that communities hardest hit have access to safe, effective healthcare, and that the difficult and vital conversations that we spoke about are continuing to occur. And to Liesl, we've worked together many times during these unprecedented times. So thank you for being a resource to NCCHC through it all. To both of you, our deepest thanks. To all of you sitting in our audience, we hope you enjoyed this discussion on COVID-19, racial disparities, and corrections. Thank you for being with us this morning. We hope you take advantage of all that is available to you during the National Conference on Correctional Healthcare. With that, have a great day.